The World Health Organization says a mysterious new virus detected in the Chinese city of Wuhan is likely to be from the same family that produced the deadly SARS and MERS outbreaks. So far, 59 people have been infected with the virus, putting health authorities all over the world on high alert as scientists race to find out more about it. Dr. Irani Thevarajan is an infectious disease physician at the Doherty Institute and joins me now from Melbourne. Good afternoon to you this afternoon. How concerning is the detection of this mystery new virus?
Yes, the virus is at this stage recognised as being part of the coronavirus family, which, as you've correctly mentioned, is also where SARS was linked to, or part of the SARS larger coronavirus SARS family. But coronaviruses can also cause the common cold. So at this stage, what we are aware of is that the virus has been identified as a coronavirus in some of the affected cases. There's still a lot of work being done to try to work out exactly what this coronavirus strain is. It doesn't appear at this stage to have had any of the concerns about there being any person-to-person transmission of this virus, and there also doesn't appear to be any mortality linked to any of the cases that have been affected by the virus. So at this stage, it's a syndrome and cluster of infections that we're aware of, and the health community is on alert. But we haven't seen any evidence to make us concerned that it has the same severity that our past experience with SARS has.
What symptoms have patients with this virus presented with?
It's been reported that the typical symptoms have been fever, as well as respiratory symptoms such as cough, shortness of breath, runny nose, a little bit like what most patients present with a common cold. But we have limited information on the cases that have occurred in China. So from what has been reported so far, we have a sense that it is a respiratory syndrome, but we don't know the exact breadth of the symptoms yet.
In the past, there have been some concerns about China's transparency in relation to new viruses. Are there any concerns that China might be keeping some information about this one secret for now?
We're not aware of any concerns. There's a large public health network that we're all connected to. When the virus was identified, most laboratories and clinicians were notified that this virus was a member of the coronavirus family. So we're not really aware, and really as information, we've had daily updates on this evolving outbreak, and there's nothing to suggest that there's any information being withheld from the larger global community.
In terms of the timing, it is similar to the time of year when the SARS virus emerged. Is there anything significant in terms of the beginning of the year in Asia for outbreaks, perhaps being a seasonal virus, for instance, and why that might provide authorities with increased concern?
Some viruses have a seasonal predisposition. Certainly coronaviruses and rhinoviruses have a seasonal pattern of when they appear. I'm not sure that the start of the year in China necessarily is one of those seasonal points. However, there's a lot of activities occurring. So there's been a large spring festival in China. We know that the Chinese New Year festival is coming up. So there's probably a lot of mobility of individuals around China at this time of the year.
All right, so at the moment, you're interested but not alarmed?
We're interested, we're on alert, we're communicating with our international colleagues so that we get daily updates, but we haven't had any information thus far to make us alarmed.
Dr. Irani Thevarajan, thank you so much for speaking to ABC News.
Thank you.